This weekend, we've taken an all-hands-on-deck approach.
Health agencies across the country are bracing for a rise in coronavirus cases as officials urge people to take precautions to keep themselves and others healthy.
If you feel sick, stay home. If you're starting to feel sick, don't go to work. Don't go to school.
A federal task force led by Vice President Mike Pence is monitoring developments, prepared to deploy federal assistance to affected communities.
I'm more confident than ever that we are bringing a whole-of-government approach. The President has directed the full resources of the federal government.
Now, members of Congress are working to secure those resources.
I asked for $8.5 billion, $1.5 billion to the CDC to continue rapid response, $3 billion to public health, $2 billion to reimburse state and localities, and finally $1 billion to get this vaccine over the line.
A vaccine, still in development and at least a year away, could curb the spread of the virus. Lawmakers are pushing for it to be covered by Medicare, making the vaccine free for one of the most at-risk populations, senior citizens.
Under Medicare, some vaccines are covered, some vaccines are not. We want to make sure that this one is covered and make it clear in the law.
I'm David Daniel reporting.
It's dangerous because of several reasons. One is that our health system is not strong enough to provide those respiratory support systems that are required to care for patients that are infected, as we've seen in China there. So very few countries will have those systems in place in their hospitals to care for a large number of patients. They may have it to care for some patients, but not a large number of patients if they are overwhelmed, like what we are seeing in China.
So it's clearly important to really stop this virus in its tracks everywhere, but particularly in Africa. If we cannot do that, what is the scenario for health systems?
We don't have a choice. We have to scale up our ability to train many people quickly on infection prevention control, to enhance the screening of our ports of entry, as quickly as possible, to cascade the diagnostics into the country so that our strategy continues to be rapid detection and rapid containment, because there's no way our health systems will be rapidly improved to be able to cope with a large outbreak like what we are seeing in China.
If you see communal transmission in countries like Nigeria and other African countries, should borders close?
If we are beginning to see community transmission there, which is the scenario which we truly don't want to see happen, because that will mean it will ensure that the sustained transmission and it becomes very difficult to contain. At that point, we can't speak anymore of a containment strategy. We move to a mitigation strategy. What do we do to mitigate the effect on the community? That will require that we start closing down places of mass gatherings, the churches, schools, public facilities, and that will have a severe economic impact and social impact on the continent.
Love in the time of coronavirus. And love, as they say, is blind.
Why are you here? There's coronavirus.
Well, my girlfriend says it's not problem.
Andrei from Russia is wearing his mask upside down. Perhaps because, at least on the surface, people here aren't panicking. The few tourists left in Milan do as the Milanese do. Nadia Oganjanovic and her husband Lazar from Montenegro aren't concerned.
I saw relaxed people. Nobody cares about corona. I think that's propaganda.
This virus is only because you have already some problems, or you are sick or problems. Something like that. For us, probably for us in Montenegro, we are strong people, and for us is nothing.
In this era of fake news, it's not surprising that so many shrug off the disease, even if the lion's share of the cases in Italy are here in the Lombardy region.
I'm not afraid. It's hysterical, I think.
It's hysteric. It's hysterics.
Yeah. Yes.
Really?
Really?
Do you have a mask?
No.
No?
No.
Fears over coronavirus have led to an epidemic of hotel cancellations. Parliament member Giorgia Meloni of the Fratelli d'Italia party is appealing via Facebook for people to visit Italy.
Don't leave the most beautiful tourist destination out. You will find a healthy and happy nation, very proud to have you here with all the excellencies it has to give. We wait you here in Italy.
These Scottish sisters shrug it all off.
So, are you worried about coronavirus?
No, not at all, no. Why? Because as my sister said, it's just a bigger strain of the flu. So we're not unwell, we're young, fit, healthy people, so there's nothing to be worried about.
The United States has advised its citizens not to travel to parts of Italy affected by the coronavirus. And of course, we're in Milan, which is affected by the coronavirus. And try as we might, we did not find any American tourists here on this day. For the few tourists here, fear is for the birds. Ben Wiedemann, CNN, Milan.